Hey guys, this is Celeste. For those of you who are watching this on YouTube and not on my blog, let me give you a quick introduction. I'm a pharmacist and I worked in retail pharmacy for 14 years until I found myself on the other side of the counter as a patient for 7 years. And during that 7 years, God taught me many lessons and showed me the pitfalls that patients can fall into with prescription drugs. So I want to do a tutorial for you today to show you how to check for your drug interactions. This is my blog for those of you who haven't seen it before, and just FYI, you can subscribe right here in your email if you'd like to get it in your email when I post a blog. I promise I won't send you a bunch of junk. Only my blog. Okay. Go up to your browser and clear out what's there. And the site you want to go to is drugs.com, drugs.com. Return, and that will take you to drugs.com. Right over here on the right, you want to register. So we're going to walk through that. Even though I already have an account, I'm going to make a new one. I'm going to punch in my email address. Okay, and I'm going to make a username. And my password. And I will select my age, which thank goodness I'm still in that group, but close. And I would check I'm a healthcare professional, though since most of you probably are not, I'm going to leave that unchecked. You can sign up for newsletters, but if you don't want a bunch of junk in your inbox, then I wouldn't do that. And then you have to punch in whatever they ask you to punch in here to make sure you're not spam. Accept the terms and register. Okay, and now this is just a bunch of stuff that you can do for your account. I don't usually mess with that stuff. Alright, what we're going to go right to now is interactions. So up here in the blue bar, it gives you some choices, and you want to go to interactions checker. You have to agree to their little terms here again. Just say they're not held liable. And this was something I was playing with earlier, so ignore that. You will have a blank slate. Okay, your interactions list is empty. It should be what it says when it pops up. So we're going to do the example like I did in my last blog post. We'll use those medications. Cymbalta. And see, it will, once you start typing it in, it will give you your choice. Just make sure it's whatever it says on your prescription bottle. Make sure you're punching in the same thing. Cymbalta is for depression. We'll use Imitrex, which is used for migraine headaches. And we will use, I'm going to throw an antibiotic in there. So you have a sinus infection. We'll just use Amoxil. And then last, we will use a cough syrup like Delsym, which is over the counter. You can walk in any drugstore and buy it. Alright, so we've got this list, and granted, Amoxil and Delsym would not be things you regularly take, but we're going to save the list, and you can give it another name or you can leave it my drugs list. Save list. Okay, and now that you've got your list there, you're going to say check for interactions. Alright, now here we go. Interactions between your selected drugs. You've got a major interaction between the Delsym and the Cymbalta. You've got a major interaction between the Imitrex and the Cymbalta. And then you've got a drug-food interaction with Cymbalta, telling you that certain drugs or beverages you should not drink with Cymbalta or eat with Cymbalta. And then here's a little interesting thing. Other drugs that your selected drugs interact with. Amoxil, more than 30 other drugs. Cymbalta, more than 500 other drugs. Delsym, more than 50 other drugs. Imitrex, more than 40 other drugs. It is so difficult for a pharmacist, as busy as they are, to have time to go over every interaction with every patient. One more thing I want to show you here is if you happen to be a health professional, or if you had checked the health professional box, you're going to have much more medical lingo here in the paragraph that's telling you about the interaction. But you can switch back and forth. If I switch to professional data, then you'll see you get a lot more words that you might not realize. If you are a health professional, though, you might want to read the health professional data. Otherwise, leave it on the consumer interaction data. And then if you want to print this out to take to your doctor or your pharmacist, I don't hesitate to do that, because that helps hold them accountable to make sure they're giving you all the information and not leaving anything out. Because like I said, it is so hard for pharmacists and doctors. Nobody knows everything, and it's very difficult for them to cover everything with as busy as they are. So that is the tutorial for today. I hope that you will gain something from it and put in your medications and see if anything interacts. And if they do, then go to your pharmacist or go to your doctor and ask some questions about it. Watch for another tutorial. Maybe next week we'll do one on pill identification or side effects or something else. But anything that helps you become more knowledgeable about your health is a good thing. As busy as things are today, as busy as pharmacies are, pharmacists, doctors, the craziness of insurance, any way you can help take some control and responsibility for your own health is a good thing. I hope this tutorial was helpful for you. Thanks. See y'all next week.